Hi, I'm Matt Ellefson, founder of Survive It, and welcome to Fearless Friday. We're going to be covering a topic called radiation therapy, and I think a lot of people view radiation as a one-size-fits-all type of scenario. It doesn't matter what cancer center you're at, it doesn't matter which doctor you have, radiation is radiation. And you're going to want to listen to this segment today because radiation therapy is complex. There are many different types of radiation therapy, and there's reasons to have those different types. And there's also many cases you should have a second opinion before you have radiation therapy. So you're going to want to listen to this segment. We have an incredible guest today, Dr. Chad Rusthoven from the University of Colorado Cancer Center. And Dr. Rusthoven is a radiation oncologist. He's doing some fantastic research at the University of Colorado, which is one of the nation's top cancer centers, and if not, one of the world's top cancer centers. But I'm going to let Chad tell us a little bit about himself and about why he chose radiation oncology for his career. Dr. Rusthoven, welcome.
Thank you. Thank you so much for having me, Matt. And thank you for that nice introduction. So as Matt said, my name is Chad Rusthoven. I'm a radiation oncologist at the University of Colorado. And I guess a little bit about myself. Briefly, I grew up in Florida and went to school there, and then went off to residency here in Denver at the University of Colorado. And then I graduated and was offered a job to stay on as a faculty member there at the university, which was a dream job for me. And so I was very happy to take that. And at the university, I specialize in lung cancer and brain tumors. And so that's the focus of most of my clinical activity, as well as my research. And maybe I should start by just telling you what I think is special about our field now that I've been in it for some time now. So oncology is a multidisciplinary field that involves multiple specialists, medical oncologists who do the medications, surgical oncologists who do the complex oncologic surgeries, and then radiation oncologists who specialize in the delivery of radiation for the treatment of tumors. And depending on what type of cancer you have and what stage it is, you may meet one or all of those folks as part of your care team. And so from our side, from the physician standpoint, it's a very collaborative field where we're constantly interacting with different people who have different areas of expertise, and trying to come up with the best possible treatment plan for an individual patient is really a team effort. So that's very exciting. And then oncology just is a highly research-driven field that's constantly evolving and moving. And so it's a very stimulating field to be a part of. And then probably the most important thing is that the patients that I get to treat, patients with cancer, it's a very special population who are going through something that's quite often the greatest challenge of their lives, and their strengths and their vulnerabilities. And it's an incredible privilege to be invited into that space to help take care of people as they're going through something that's really profound, not only for them, but also for their loved ones around them.
It's fantastic. It's fantastic. And we're grateful for people like you that have chosen this as a field, because there's one thing I've found that, I've had a lot of medication over the days and a lot of treatment. And the one thing that I lack is a lot of doses of empathy from doctors, And so when you get somebody that's passionate about their career and that's doing it for the right reasons, because they truly want to make a difference, we just love you for that. And we love people like that. So it's great to have you doing what you're doing, and it's great to have you here with us today. So thank you for taking the time out of your busy day and be part of this. Well, I would really like to start out with something that might seem simple, but beneath the surface it's rather complex. And that is, can you talk a little bit about the different types of radiation? Because I think a lot of people feel that all radiation treatment's the same.
Radiation therapy, just in broad strokes, typically involves the delivery of focused X-rays that are delivered with sufficient enough energy to damage the DNA of tumor cells, while hopefully preserving the function of normal tissues that are around the tumor. So, our goal is to eradicate tumors and cause no side effects. And of course, those are difficult goals to achieve each on their own. And the way that we try to deliver radiation can vary quite a bit depending on what our goals are. Radiation can vary from a single treatment to a treatment that's broken up over 6 or 7 weeks of Monday through Friday type treatments. And so and then everything in between. So there's quite a bit of variability in the patient experience. It's a pretty complex thing to break apart, and there's no exact way of doing it. But I'll try to talk about some kind of common types of radiation that people might be offered by their radiation oncologist. And hopefully in doing that, we'll kind of cover all of the main bullet points. So for somebody who, let's say just a hypothetical case where someone has a lung cancer, and the goal of treatment is cure, where we're trying to do everything we can to get rid of the cancer forever and never have a recurrence. And the doctors say that radiation is the best way to do that. And that's the treatment plan that's prescribed. A patient might be prescribed a course of treatment that's 6 or 7 week treatment of Monday through Friday treatments that last about 5 or 10 minutes a piece. And so it becomes kind of a routine where they're showing up for their treatments each day over a long course of time. And so that's one way of doing it. And we could call that conventionally fractionated radiation, which is kind of the tried and true way of doing radiation over a number of weeks, where you're trying to, with each treatment, decrease the number of cancer cells while just doing a little bit of treatment each day that doesn't hurt the patient and the normal surrounding tissues. That's one way of doing it. Something that's kind of on the other end of the spectrum, that you may have heard this buzz term out there, is something called stereotactic radiation. Stereotactic tends to refer to a high dose treatment that's delivered in 1 to as many as 5 treatments. And there's a little bit of variability even in that definition, where sometimes people will include up to 10 treatments kind of in a stereotactic paradigm. But the big thing to keep in mind with stereotactic treatments is very focused treatment with a high dose of radiation delivered in that treatment, delivered in 1 to several treatments. And so that is a much different experience for a patient, because if they're having that treatment, well, they might only have to come for 1 treatment total. When we're delivering high dose focused treatments, and when that would be appropriate is basically when we have a very well-defined target on a scan, such as a chest CT or a brain MRI, where we know very clearly where the tumor is and what our target is. And it's small enough that we can deliver a very high dose of radiation to that area without causing major side effects. And so the interesting thing about stereotactic radiation, because it's always about delivery of high dose radiation to a well-defined target, is it's actually delivered most commonly on 2 opposite ends of the cancer spectrum. So one example would be a person with stage 1 lung cancer. So stage 1 lung cancer typically means that the tumor is just involving the lung, and it has not spread to the lymph nodes in the chest. And so you have a very well-defined target in the lung that you're trying to eradicate with high dose radiation. And so that's a good time to use stereotactic radiation therapy. And in fact, that's in patients who don't have surgery, that's considered the standard of care, is to do that. Then on the other end of the cancer spectrum, when patients have stage 4 disease and they have metastases that have gone to a different organ, like let's say, for example, the brain, they may have a very well-defined target in the brain that we want to eradicate with focused high-dose radiation. And that's another common application for stereotactic radiation is the treatment of brain metastases. The interesting thing is that in between those stage 1 and stage 4 indications, you may have someone with stage 2 lung cancer or stage 3 lung cancer, in which case they have not only the primary lung tumor, but they have involvement of the lymph nodes in the center of the chest. And in order to actually treat all of that area safely with radiation, we have to do the conventionally fractionated radiation that's delivered with a small dose of radiation each day for several weeks. So once the target becomes bigger and there's more normal tissues around that area, we tend to have to be a little bit more conservative with our treatments and break them up into small doses of radiation each day. So that gives you kind of the spectrum, if you had to put things on two opposite sides of the spectrum in how radiation can be delivered. You have a very short course of radiation with stereotactic radiation therapy, and then sometimes you have a much longer course of radiation with conventionally fractionated radiation over several weeks. And the reasons to do those things can really vary quite a bit depending on what's going on. Then there's also a lot to talk about other ways of doing radiation for patients who have, in particular, stage 4 lung cancer or other stage 4 cancers. If they have a metastasis, let's say to a bone or some other spot that's causing symptoms, there may be a treatment that's offered that's actually not the 6 or 7 weeks of radiation, and also not so fast that it's stereotactic radiation. In the middle, there's kind of common palliative regimens that can be used to treat things like bone metastases, for example, that are delivered over the course of 5, 10, or 15 treatments that are really designed to improve symptoms like pain. And so that, again, is kind of using the strategy of conventionally fractionated radiation, where you're delivering a moderate dose of radiation each day and repeating that, and hopefully getting rid of cancer but not causing symptoms. But oftentimes in those situations, you're treating a larger area than can be treated with a very high dose stereotactic approach.
Well, Dr. Rusthoven, you have been a wealth of information today to all of us living with this disease and wanting to learn more and really understand what we're up against. And so I just want to say thank you from the bottom of our hearts, all of us dealing with cancer and facing this disease, for you to take the time that you did today and spend with us. We're very, very grateful for that. So thank you for all of it.
Well, thank you so much for having me. And I can't say enough about how amazing it is, what you guys are doing, and the hope that you guys are giving for patients. And it's just really a privilege to get to participate.
We hope it was informative to you. It certainly was to me. And I just want to remind everyone that no matter what questions you may have or concerns that you may have, always feel free to contact us at info.surviveit.org, and we will do our best to help you. Until next time, I'm Matt Ellefson. Stay strong and live fearless.